Hi, Jinder. How you doing?
Hi, Joe. I'm great, thank you.
Good. Well, I'm super excited that you're going to come and join us in the Embracing Nutrition team. And I just wanted to introduce you to our audience. Now, tell everybody a little bit about your background and what brought you into specializing in nutrition and then particularly focusing in the world of oncology. So it's a bit of your background.
Yeah, so my first experience was when I was about 24, 25, and my mother was diagnosed with ovarian cancer. I don't even know if I really knew about cancer at that point. I was busy in my life, studying university, and I became her main carer, and which was gave me time with my mother for 4 years. Unfortunately, she's not around anymore, and I do believe that if I knew then what I know now, perhaps I could have saved her life. And then 12 years after that, following that, I uh, threw myself into learning everything possible about cancer from the moment she had it: books, people, doctors, oncologists, naturopaths. I mean, I was already in that world because my parents were um, Indian, they followed Ayurvedic medicine, they followed yoga, very Eastern in their thought process, all natural, organic food. So I was already in that. It wasn't too difficult. And then 12 years after my mother, her sister got diagnosed with ovarian cancer. So the same. My mother was never tested for BRCA that we know of, and my aunt was tested and she was negative. So they both had the same, but one was BRCA. Assuming that we were assuming my mother was BRCA, but aunt was not. So then I started digging into that and realized that actually it was a genetic, possibly epigenetics and lifestyle. There were things that I put together that they both had, because they're two of six sisters, uh, and I just came up with the things that I thought caused their cancers. And
And
then I
from that, because you did find out that there was BRCA in the family, didn't you?
Yeah, I did. So then that led me to hugely curious, but also nervous because what you don't know won't hurt you, kind of thing.
Mm.
So in about 6 years ago, 5 years ago, I had the BRCA1 test done and it came back positive, and I
Wow.
was very, very shocked. Didn't think it could happen to me because I'm always been into health and fitness, the whole how could this happen to me thing. It's not true. And I think I had about 6 months of shock.
Yeah.
And then I became very, very proactive, and I pulled in all the resources, being in that industry, in that world already for 10 years, over 10 years, because I worked for a company, an amazing French company that produces supplements, science-backed supplements, and training and education, a little bit like the College of Naturopathic Medicine, with their sister company for the training and education. So I'd already been learning everything about mechanisms, anatomy, physiology, pathologies. And then that just that just continued.
And obviously getting that diagnosis of the BRCA gene, our NHS, in somebody who hasn't got cancer, very much goes down the route of elective surgery, don't they?
Yes.
Did anybody ever talk to you through the eyes of our medical world about anything else that you could do to try and prevent this gene from turning on?
So I kind of went a bit wild and mad and decided to get three different opinions from three different trusts, from the Royal Marsden, which is supposed to be the top
Cancer expert.
hospital, and I had Angela George, who's supposed to be the number one oncologist in the country, or one of them, from St George's to St Bart's Hospital in London. None of them knew I was working with the other. Went to every single one of them, had all the tests done, and every single one of them gave me the same advice, which was double mastectomy and full removal, hysterectomy, to be on the safe side. At this point, I was 40 years old, roughly.
Okay.
wasn't sure if I'd finished having children, knew that I'd be thrown into menopause, but not once did anybody give me any other options of, you're going to be fine if you do prevention work. Nothing. That was my journey. Well, that was my journey after that. So I spent perhaps the best part of 3 months doing all that, and realized through lots of tears, lots of stress, that nothing was sitting right with me. That was not my journey, and I needed to find a different way.
And I think that's what I love about your journey, is actually that you've really been in the trenches, haven't you? You've really felt those emotions. And I think until you've felt what it feels like to be told, if you don't take your breasts off, if you don't have a hysterectomy, you're going to get cancer and you're going to die, which to all intents and purposes is what they were saying to you, isn't it?
Oh, yeah, absolutely.
You don't do this surgery, you are going to get cancer, Jinder, and you are going to die and leave your children without a mother.
Yeah.
And I think what's so important for people to hear, and listen, you said it, it's your story. It's not somebody else's story. And I think none of us are ever knocking anybody's personal choice to have surgery from a prevention point of view, personal choice for active surveillance, personal choice. And I don't want to share all of your journey, part because that's your journey and nobody can reenact exactly as you. But what you really looked at is not just the genetics, but epigenetics, the environment that you bathe that genome in to try to give your longevity the best possible chance and the best possible prevention plan, didn't you?
Yeah, I absolutely did, and I did look into absolutely every book, source of research. I could not find another person that was thinking like me at that time. I spoke to friends, naturopaths. Can you put me in touch with one person who didn't do what the doctors said and actually followed a different path? Not once did I meet anyone. There was the 99.9% of the population do the preventative surgery, and then and like I said, I didn't want to do that. So then I came across you, and that was truly life-changing for me, because I didn't even know half the things that were going on with me, and perhaps I was a ticking time bomb. That would have happened to me if I hadn't have rectified and changed what I did, like the polycystic ovaries, which never bothered me, never had any symptoms of it, got pregnant, knew it was there, but that was the first thing that cleared away once.
Sign of androgen dominance, which is a hormonal imbalance.
Yeah.
So that is a risk factor.
Yeah. So, and I had lumpy breasts, like many women do, and we just think, oh, it's hormonal, it's monthly sore breasts. There were so many little things that I was not paying attention to, and all of a sudden my radar was on, and I was being more vigilant and just really getting in tune with my body. And obviously I needed someone to hold my hand through that journey, and I was just one of the very fortunate people that found you, and I started that journey. And and of course I was nervous at first, thinking, is this the right thing? Is this really going to be okay for me? But within a matter of months, I knew I was starting to feel different and better, and I was actually becoming so confident because I was controlling my journey. And that's when I started testing more often, and I was just checking what's going on, from thermal imaging to my supplements. I was one of those people that I can remember texting you saying, I want to do another test. And you'd say, well, you only did it a month ago, but, and I could just see the changes, and it was life-changing. It has been life-changing.
And then to tell everybody how that then took your own education, because now we're looking at two different things. We're looking at your health journey, but we're looking at your education path and where you took that even deeper to be a guide to other people.
Yeah, so at the beginning of finding out about BRCA, I was BRCA1. I just started studying at the College of Naturopathic Medicine in nutritional therapy. And then that journey just became so much more important and needed for me. I met some incredible people on that journey, classmates, people, students that have gone on to become incredible professional nutritional therapists. So, and alongside College of Naturopathic Medicine, I was still working at my old job, which was, again, they were training me constantly on incredible science of the body and pathologies and different supplements that work in different ways. And so, and I just knew that I really wanted to specialize in cancer, but I knew that it was going to take me some time to get to the level that I needed to be at to look after other people. So I've been working in other various different areas like autoimmune, pediatrics, hormones, which is one of the popular ones, and toxicity in various different areas. And meanwhile, I've been studying with Dr. Nasha Winters. I'm doing the physician course, and that has really just blown my mind and sent me into a place of huge confidence where I now think that I know I've been having clients and I know that I'm there now. I can take that role on because it is a big role to take on.
It's a huge role. And to those of our listeners that aren't familiar with Dr. Nasha Winters, Nasha is one of the most amazing international naturopathic doctors who's been on her own stage 4 cancer journey and is thriving with stage 4 cancer. Her book, A Metabolic Approach to Cancer, and her metabolic training is world renowned. And her approach is very much about dig down deep and understand the terrain. So our job as non-oncologists is not to treat the cancer. Our job is to optimize the terrain, the soil. Now, if the soil is out of balance, the body is going to grow weeds. And however much you cut those weeds off at surface level, so for a few minutes, it apparently looks like there's no weeds in there. The minute you blink, the weeds are going to grow again.
Yeah.
So a terrain-centered approach is about digging out the soil. It's about nourishing the soil. It's about watering the seeds, and it's about the sun shining on them and letting flowers grow. And that's what Jinder, that's what myself, that's what Susie, that's what we're all trained in, is really understanding soil-based level.
Yeah.
So if I could ask you to leave with a motivation to anybody out there that's listening to this video, whether it's themselves that's on their cancering journey, maybe it's one of their loved one, maybe they've been through treatment and they're at that point of holding their breath and not knowing when they can release the air for fear of relapse, fear for the future. What would you say to our listeners?
I think putting together my own experience and the experiences I've had with family members, other family members who've been through that journey, I would say there's always hope. And I would say one of the most important things is to take control of your own journey and to be informed and to have someone hold your hand. You don't have to do it alone, because it's when you're on your own and you get confused about making choices and decisions and you let someone else do that for you. I think it can work well as an integrated approach, rather than just one kind of approach. But the main thing I would say is there's always hope, and never give up hope.
Yeah. And I think that is so, so, so powerful. And for you, from your mouth as a patient that sort of took away your ticking time bomb and replaced it with empowerment, replaced it with education, replaced it with a knowledge of your own body and your own terrain, that is so powerful for our listeners to understand that you've been through this journey. You've been told that if you don't do this, there's no hope. And you've realized for yourself that the more you've educated yourself in your own body, the more you've become a maestro of that journey. And that's why I would you to join us here at Embracing Nutrition, because nothing is more powerful than that. So thank you so much, Jinder. Thank you to all of our listeners. And if it is you or it is one of your loved ones, please hear Jinder's words. There is always hope. Where there's life, there's hope. And therefore, it's about making a difference. So thank you so much, Jinder. And
thank you
to all of our listeners.